Good evening, social media. Thank you again for being online with the JADASA Live broadcast. We have some very interesting information today that we're going to talk about, a need that is very much so needed in the community, surrounding the communities. But first and foremost, I want you to, if you're online, please like and share. Go to the JADASA Facebook page. You can go to my page. Like and share. And I tried to put this on the ARCA page, but I couldn't find out, but we will get it on your page as well. So today we have Mr. Suneal Menzies. He is with ARCA, which is the Assisted Recovery Centers of America. And they are bringing something that is very valuable to the community. And before we get started, first I want to thank you, Mr. Menzies, for agreeing to come on to the broadcast to share, to let the community know the resources that you guys have, what's available to them, when it's going to be out there, and the frequency that those that need it or their family members that need it, it will be available to them. So I want to thank you for coming on to the broadcast.
Absolutely, Cynthia, and thank you. I'm really excited about the opportunity to talk a little bit tonight about what we're doing in the addiction and mental health world, our commitment to our underserved communities, our minority communities, our African-American communities, especially in the northern corridors of St. Louis, and excited about the possibilities and the partnership with JADASA as we go forward. So.
Awesome. So I want to, let's just dive right in it. Now, ARCA, you guys have been around for a while.
About as long as you guys have. 2001. We were founded in 2001 by my father, Percy Menzies, really with the idea that really focusing on the idea and the concept of addiction medicine, that if medications and behavioral therapies were combined, the outcomes would be significantly better. We had seen it over the last 25 years in mental health where there had started to be conversations around we take medications and we make changes. We've seen it in other chronic illnesses, diabetes, hypertension, cancer. We don't tell someone who has diabetes, take your insulin, take your metformin, take your medications, and then go eat all the junk food you want. The two have to go hand in hand. And that was really the concept that if science and behavioral therapies, many of the things I'm sure you provide to your women and to the people you serve, if those are combined with medications where we control the biology, the outcomes for those struggling with addictive disorders and mental health illnesses is significantly better.
Awesome. So you guys are having a mobile. What is it called?
So we're calling it our mobile treatment clinic.
Your mobile treatment clinic, and it's going to be here in North County every Tuesday, correct?
Correct. So we were very fortunate to be introduced to Pastor Ken and Beverly Jenkins from Refuge and Restoration. With their leadership and guidance, we were able to come together and really, in a small way, at least start the kind of movement and planting a seed for long-term sustainability and kind of infrastructure to access to care in these areas. We know that when someone is struggling with mental health or addiction and the access isn't there, it's very difficult for organizations, community leaders, loved ones, faith leaders to have the conversation. Mm-hmm. So it's Cynthia comes to Suneal and says, hey, you're struggling with your mental health, but I'm not sure where to refer you. And so one of the things that our main focus and really our priority and commitment to the community is access to care. And so through this, we recognized that something needed to be done immediately. And so we were able to partner with Prevent Ed, formerly the National Council for Alcohol and Drug Abuse, and through the leadership and partnership of the Department of Mental Health, we're able to launch this mobile treatment clinic, which is, as you said, in one of our locations is at St. Peter's, the UCC Community Resource Center.
Yes.
And then we have 3 other locations where we're trying to span right now the northern corridor. So Tuesdays, we're at the St. Peter's UCC Resource Center. Wednesdays, we're with an organization called Living with Purpose. They're at 8005 North Broadway. On Thursdays, we are down with Jubilee Community Church at 4231 North Grand.
Okay.
And on Fridays, starting this week, we will be with Church House Ministries, Pastor McKinney, Johnny McKinney, and that is at 6070 Harney Avenue.
Okay, awesome. So let me ask you this. Okay, so some of the women I deal with, I found out, because they deal with the abuse, and some of it because of the severity and the length and the duration they've gone through. Some of them have developed PTSD and other behavior issues. So when you all treat your patients and stuff, do they have to have one or the other or both? I know you talked about mental health, and then we talked about drug abuse. So when the person comes to you, do they have to have both, or as long as it's one or the other, that you all will still work with them?
One or the other. So we recognize oftentimes one goes with the other. Yeah. But for the women you serve, most definitely, we always see, not always, but oftentimes, in our leadership team and our clinical team always talk about those delivering the service that we be trauma informed, because we know that no one you or I have met, Cynthia, said my goal 12 years ago was to be drinking too much alcohol or to be doing something to blunt the way I'm supposed to feel. Whether that's, and no one says 10 years ago my goal was to be horribly depressed.
Right.
So we know that all of these conditions oftentimes result from our life story.
Yes.
From the people and the places and the things that we have experienced and seen. And for the women you serve and that we look forward to serving in partnership with you, it is that trauma. It is that real lived trauma. And so our thought again is, by taking medications, we can, in a very acute level, we can manage the depression. We can manage the not sleeping. We can manage the PTSD or the night terrors. We can manage the substance use from a biology standpoint. Our medical director, Dr. Rotnick, says medications take care of today on.
Mm-hmm. Awesome.
The rubber meets the road when you begin to engage in the services that really start to unwind your story through the things that the individual therapy that we provide, the group therapy, the peer support services. We work extremely hard to build connections with organizations such as yourself and the other ones. So being able to wrap the resources around the individual is ultimately what gets them well.
Awesome.
And so that's really the two-pronged approach, that medications intervene and allow the patient and the individual to really focus on getting well. And then we all together come together to kind of help them accomplish those goals. So services are at no charge to the patient or family, and they are comprehensive in nature in that we will address the patient's story and the areas that we cannot address. Then we work very diligently to link them up with the appropriate referral source.
Okay, so let me ask you this: what is the makeup of your team? I mean, or is everybody that would be able to work with a patient? Will they be at this mobile site, or do you take appointments, or can somebody just walk up? What if it's too many at one particular day? How do you handle that load?
And so that's a great question. On the mobile unit itself is a full comprehensive care team. So we have nurses, we have social workers, we have housing specialists, we have community specialists, we have providers, whether it's nurse practitioners, doctors, whatever the case may be. So it's a comprehensive team that is able to really work with the patient. In terms of, if they're not appropriate for us, we can make the referral. We never will turn someone away. So while the mobile unit, of course, and as you and I were talking earlier, the long-term sustainability will come from more structured partnerships with leaders and pillars in the community already. Yes. But the mobile unit, yeah, you're right. You can, to do it properly, you're talking maybe 4 to 5 new patients in a given day, because you really have to spend time with the individual. And so in the event that we have more patients than we can serve, then we have different options, whether that's transporting them to one of our main offices, setting up an appointment for the next day. But we have not had, our commitment really is that patients do not need to wait more than 24 hours for help.
Okay.
and we understand, especially the people you serve, that is when the little
Yes.
window is open that says, let's get help.
Yes.
We have to be able to be there. It doesn't work to tell someone, okay, it's okay, just tough it out for 6 more days. Just tough it out for 10 more days.
Exactly. Right. So I with the mobile, and because I know some of the clients that comes up to the resource center, some of them are homeless. Some of them are homeless. And so is the mobile big enough for them to, do whatever it is you need to do in there? Or will you go into the resource center? You have a spot there to, like if they're doing the treatments for detoxing or whatever,
Yep. So we do everything in the mobile unit. It's a really comfortable space, 3 separate rooms. There's a lounge with a couch and kind of a waiting room, an admission room, an actual nursing room. We do use the facilities that we partner with if a patient's very sick or to go into the bathroom. Now, St. Peter's is just, a great partner to have because of all the resources, and oftentimes we can connect patients right there to the other resources they need. Part of what we try to do on the mobile treatment clinic unit also, Cynthia, is to be comprehensive. My father and our medical director always talk about we need to make treatment attractive. We need to humanize it. And we do that by providing our patients education, feeding them, hydrating them. So we try to be comprehensive and not just say, come get your meds, but it's really hey, we are here to take care of you. We are here to love you in partnership with the organizations. And oftentimes for the mental health and substance abuse, that's a really key ingredient. That human touch is so important in getting people well. And so you're right. It is most of what we do is on the truck because it keeps it private, confidential. It's between us and our team, but there are reasons, of course, that we would go in. But oftentimes there's no need for that.
So before we came online, we were talking briefly about it, and you made the statement that it takes people in the community to work. So do you have some of your staff members, are there people from the community who live here or maybe are familiar with, grew up here or work around in the community where the people will be able to really identify, maybe not know they know them, but they, when someone is out of their element.
Absolutely. And we have, as an organization and as a leadership team, I can say that we have worked very, very hard beyond what we thought we already knew to continue our cultural competency, to keep learning, to be better listeners. There are some real kind of pillars in the African American community on the treatment side. Joe Yancey, who used to be at Places for People, and Laurent Jarvois, who's with the Department of Mental Health. They've been instrumental in kind of educating and providing this cultural competency piece. But much of our team has also had a real background in kind of homeless healthcare and outreach and those types of things. But to your point, Cynthia, yes, our staff, we are staffing the unit with staff that come from that area because it's a very exciting project. We're giving everyone the opportunity to be a part of it. We know that this time in our history is pivotal. There's going to be the right side of it and the wrong side of it. So we are working hard to be on the right side of where medicine and technology and race and all of these things are going to cross. But yes, we staff with culturally competent people. We do have, depending on the communities we go into, we try to be mindful of that and staff with the appropriate people. To your point, there have been glimpses and efforts in all sectors of medicine from the outside world to come in and provide a cure, provide the answer. We understand and we have been taught, and we agree, that the organizations such as yourself, people such as yourself, UCC St. Peter's, the work is already being done. Right. We need to come in with these few resources we have and plug up some gaps.
Yes.
And that's part of what we're doing too, that the movement, and for this to be long-term and sustainable, for this to have a real meaningful impact in the African-American communities, it has to take place from the inside out.
Exactly. That's what we're talking about. Relationship.
That's it. And that's why tonight when you invited me, absolutely. Like this is, it doesn't, no one cares about Suneal. No one knows what ARCA is. But hopefully tonight, when someone's heard me talk to Cynthia, they now can say, maybe tomorrow, maybe next Tuesday, I can at least come by and check out this thing. I'll at least drive by it because Cynthia endorsed it. And so that's part of what we're here. We're in this early stages of building relationships and understanding where we can be most impactful with the gifts that we have and we've been given. So, in that sense, I think we are also looking as we expand to start, not only do we have people currently on staff who come from these areas, but we're needing to recruit and hire more. And so we know that if we can, start to really have teams that come from the city and the county, North and County and North City, that understand the area, that know the people, that's what's going to bring about long-term impact. And so one of the things that, I'll be excited to talk with you about, and we've started the conversation with the churches, is help us recruit from within. If there are administrative folks, if there are counselors, if there are social workers, if there are nurses,
exactly, that'd be awesome.
Volunteer, but we're not looking for volunteers. We're looking for paid people too. But if there's someone who wants to volunteer, if there is what we call peer support specialists, both on the mental health and substance abuse side, those that say, I have lived experience. Many of your women are going to be a perfect fit to say, I have come out better and stronger on the other side.
Yes.
Those are the positions, those are the areas that we want to be able to recruit. And you can go higher. We are looking for the right person with passion and true
exactly empathy. Compassion. And you know what? You can't fake compassion. You cannot fake compassion.
Absolutely. And we can teach you how to use a computer, and anyone can learn. It's my father and our medical director. Only 5 medications in substance abuse, right? It's to your point, the intangibles. Can you love? Do you have compassion? Can you listen to the story? Can you understand the story? Can you relate to the story? And if you can, then I believe our work is very doable.
Yeah, that's awesome. Actually, I just did a Zoom meeting with a church last week about domestic abuse in the church and stuff, and they was just like, wow, we have to have a part 2. So I'm actually doing it again Wednesday, because it's some things I brought out they wasn't aware of. We have to be careful. You have to be careful how you respond, that you don't re-traumatize a person, how you handle them and things of that nature. So absolutely. I know we talked about earlier, give me some statistics. We talked about statistics and you said that the numbers was just alarming. Was this before pre-COVID, or this was an escalation, or because of pre-COVID, because of the, people stress and not having jobs and not having food, all the stuff that everybody, just about almost everybody was going through, everybody was at home, and so did that escalate, or it cause a person to, maybe did you have new cases coming out of it? They couldn't deal and couldn't cope. So there was a mechanism they resorted to try to deal with all of what happened. What happened to make that case? I could tell with domestic violence, the cases rose astronomically because of the shelter in place, because they were sitting there with the abuser. So those cases, they rose, astronomically, and they didn't have a reason, or they couldn't call to get help because the person was there.
Yeah.
So is that one of the reasons? What was the statistics before, or did it escalate because of COVID, or?
And so, we've seen just horrifying numbers across the country with the opioid overdose and the opioid crisis, now really a fentanyl crisis. But, if you look, Cynthia, from January through June of 2019, and then you take the same time period, January through June of 2020, there was a 56% increase in overdose deaths among the African American and minority communities.
Wow.
While we saw a decrease in that among the Caucasian and other groups. Yes, absolutely made worse and exacerbated by COVID. Loneliness, boredom. We saw the mental health crisis absolutely explode during the COVID pandemic, whether that's internally as an organization or what we're hearing from our local communities, the states, the federal government, the administration about mental health and substance abuse. But again, it seems to come down to access to care, that it is available in the areas you would expect it to be, and it's not available in areas you would expect it not to be.
Oh,
And
okay.
at the end of the day, we know that the northern corridor of St. Louis, far down to the city as you want to go and out to the county, historically, from a medical standpoint, has been underserved.
Yes.
And
Yes.
now one of the big, and even primary care and emergency rooms and all specialties are having to screen and be concerned about mental health and substance abuse. That the mental health and substance abuse, the behavioral health field in St. Louis and in Missouri, as I said, with the guidance of the department, I truly believe is absolutely dedicated to changing and kind of bringing about a new way in this northern corridor. We all have known about it, and I think COVID just reiterated that something needs to be done now. And we're really proud and excited that we, in some small way, will be a part of the solution. As I said, there are a number of behavioral health organizations that have been doing this work ahead of us. But really, from an access to care standpoint, from getting people access to life-saving medications, both on the mental health side and on the addiction side. And oftentimes both, which, as you said, go hand in hand.
Yes.
Has really been ARCA's mission, is access to care. And so we're looking forward to partnering with our other behavioral health partners. We're fortunate to have the leadership from the local communities. I have been blown away by the support and the welcoming into the that we have had from the African American and minority communities. Again, I think we recognized the need. No one really got it till we got into it. But we think, the time is now, and the problem, unfortunately, has never been worse than it is.
And it's sad to say it, because people, nobody wants to be, and I'm speaking because I live in the community. I've been here for 30 years. I live here. I live the community. Nobody needs nobody else to be preached to. We don't want you to preach to us. They don't want you to preach to them. They don't want you to tell them, A, B, and C. They, some of them, in this preconceived notion, because mental health, lack of education. Some of them are very smart and educated, but somehow it's a decision that was made. And so they just want people to, first of all, they want to be humanized. Treat them like a human. And, that's a part, even with the abuse. I was telling the people that I was speaking with, if they share a story with you and you are not humanizing them, and you're acting like, by your body language and your facial expression and your tone of voice, I said that'll cause them to go back in their shell and stay in that situation longer than they want to, because they got to muster up the courage again to share with somebody else. Now, they're not going to come back to you because you've already re-traumatized them, disappointed them. Now they got to find somebody else who they feel may believe their story. And so that's a part of that, what you said. Now, like you said, that trauma-informed care, we have to, even though we got the substance, that's just one part of it.
It's one part, the very small part of it. Because as you and I talked, no one has ever come to you or me and said, Cynthia or Suneal, I wanted to be using heroin, or I wanted to be horribly depressed. That's just not what we do as humans. So you're exactly right. The story is so important. And if we don't understand it, unravel it, begin to work on it, ultimately, that's where the rubber meets the road. And so humanizing the treatment. And part of what we're trying to do too, Cynthia, because of the stigmas, we have been very fortunate to have our partners on the harm reduction and prevention side join us. So we can look at the whole scope, mental health and substance abuse. Harm reduction, so things such as Narcan, naloxone, life-saving medications like that. Prevention, where we can educate kids, moms, dads, loved ones on how to support their loved one. The treatment side of it. And then the final part we also do is housing. So we house those with mental health and substance abuse in safe places. We do have those, of course, who are struggling some with domestic violence. So we have to be mindful of those types of things. But to your point earlier, I mean, there's a there's a homelessness crisis going on in our city too.
Yes. Oh my God. Yes.
A lot of the discussion in the behavioral health world is oftentimes this idea of medication first model to help people begin to really be able to focus, or is it a housing first model? Because I can give you the best medications in the world, but if I don't give you a place to put your head down tonight, or if I put you back in the same toxic environment,
exactly,
you will be re-traumatized. You will be triggered to say, I have to go back to my behaviors that help me feel okay.
Yeah.
They help me, and you were going to say it, they help me survive.
Yes. Yes.
And so the housing is crucial. St. Peter's is huge for that resource.
Yes.
So, it's just by the grace of God,
I couldn't have gotten a better location that when I, shared what we were doing, they said, oh, we would love for you to come. But when I went in there and I did the tour, I couldn't have it was a perfect fit. When I say it was a glove fit, it was perfect because of all the other organization that can help. A person can come, that can pretty much be a one-stop shop for somebody wholeness.
Absolutely.
To make them whole and stuff. Now you said something a while back. You said about Springwood Plaza. So are you guys going to be across the street in that Dalewood Center? Okay.
So Refuge and Restoration, under the direction of Pastor Ken and Pastor Beverly, their vision was to take that plaza and to repurpose
there's
it.
The one that's over that plaza. Okay.
And so they will be bringing in really a marketplace to the Dalewood area, which will have childcare, early childhood education, mental health and substance abuse care from ARCA, banking work. All the 13 or 14 different organizations are coming together in this plaza, and we're very excited to be a part of it.
Awesome. Now, are they at St. Peter's now?
So they are not currently. I believe Refuge and Restoration, until their new space is done, is sharing space with Tabernacle Church.
Okay.
But the pastors at St. Peter's and Pastor Ken and Pastor Beverly have been friends for many, many years. And so when we started looking for the North County sites, Pastor Ken said, to your point exactly, like they provide the mental health clinic, they have all these other organizations and resources. And after meeting with Danielle, it was like, okay, the substance use piece is missing. If we can plug this, there is really they're very humble. They haven't come out and said it, but now there's really this comprehensive behavioral health and wellness type of resource center.
Yes.
That's out in the county. And now I think it's our job to make sure we get the word out that whether it's mental health, substance abuse, homelessness, domestic violence, one of the other 20 ministries they have, St. Peter's is the place to come get your help.
Awesome. So speaking of that, now I'm putting this out. What are you guys doing, or what have you done to put it out? Because before Danielle sent me this, she told me about it, but I didn't hear anything about it, or I haven't seen anything about it. And I actually did go to your Facebook page, ARCA's Facebook page. So what else or have you put out for the community to even know that you guys are going to be there tomorrow?
So it's our website. We have put it up on Facebook. We've been there 3 or 4 times now. So we've had fairly good showing of patients. But to your point, you're right. We're still in this process of building. So on Saturday, Mayor Reggie invited us to the Dalewood Rec Center. And we were out there for about 3 hours and got to meet a number of families and people, and they were passing out food. We've been connecting with some of the local food drives to try and educate as we're out there. So, in the city, it's been a little bit different in that the areas we're on are a little bit more hard hit and kind of mainstream. The UCC has been really connecting with our partners there and those types of things. We've had some referrals come from the partners in there. So we're slowly in the process of kind of getting the word out, but we understand it. At least we feel that getting the word out is much more impactful in this manner than just running around and doing our thing. By connecting and getting the word out and building the trust and the reputation, we can kind of go in. So still working. We have purposely held on some media. We've had some media outlets that have talked, and we want to work through some of the kinks and make sure that it's kind of all humming and our partners are okay with having them come. But So far, so good. We've been very fortunate to have a few, as I said, there have been some large meetings we've been able to attend, some different congregations and groups we've been able to speak to. So the word is slowly getting out there, but yeah, we appreciate you guys putting it up on your website and doing those types of things for us. So.
Awesome. Thank you. Well, I'm excited about it. And you guys will be out there from 10 a.m. to 3 starting tomorrow, and that will be every Tuesday.
Every Tuesday from 9:30 to 3:30, yes.
9:30 to 3:30. And social media, not only if you can't go to the St. Peter's UCC, they have other sites, the Jubilee Center down on Grand. I believe that's Grand and right before West Florida.
Yep, Carter and Grand. It's right there at Jubilee Community Church. And then Church House Ministries on Fridays, which is like 70 in Riverdale. And then Wednesdays will be Living with Purpose at 8005 North Broadway. I will get you an updated flyer, Cynthia, if you would like to post that way.
Awesome. Yes, I would like to post it out there and put it out there on the website, on my Facebook page, JADASA, and then above this link, because a lot of times people may not get on it, but they normally come back and look at. So I want them to see that and to be out there. And of course, I would love to be out there whenever I just have a feeling the UCC is probably going to do something like some kind of festival. We were talking about it, something outside where all the organizations can showcase their services and stuff like that. So I think that would be good, beneficial for the community, especially we're in where we're located is actually Ferguson. That's
okay. Mm-hmm.
And everybody in creation know about Ferguson.
Yeah.
So that helps as well. As far as advertising and getting the word out, you just say Ferguson and
absolutely
whatever.
Absolutely.
So that's a good thing. So Suneal, I am so happy to have linked up, connected with you and your organization. I am looking forward to a very prosperous working partnership, because definitely what you all offer, some of my clients can definitely benefit from. And the fact that it's free, because that's the things is, I send them to some people and they, private insurance, they don't have insurance, No,
this is free, all services, medications. There is no charge. There's no hidden agenda. It is just like you said, to decrease barriers. There's not the individuals who you and I have the opportunity to serve have enough to worry about.
Right.
The last thing they need to worry about is, do I need to take care of myself, put food on the table for my baby? That's not the option here. So we're, as I said, very grateful to the Department of Mental Health for their support in allowing us to kind of run with our mission and to focus on these areas. And to the people you serve, Cynthia, whether they come through you or they come to us directly, please know that it is private, it is confidential. Your stories are very important to us. And to your point, we look very forward to the opportunity for a long partnership with you and the other partners at UCC. And I think together,
we can make a footprint.
This time, I think it's different. It really is. It's not going to be. And this time, I believe those that come together we will make a significant change in the North County areas.
Awesome. I am looking forward to it. Well, social media, when you click on, this is Suneal Menzies. He is the Executive Director of ARCA, Assistant Recovery Centers of America. They will be having a mental health mobile out at the St. Peter's UCC Resource Center starting tomorrow, Tuesday, from 9:30 to 3:30. This service is free of charge to you and your family. The staff is certified. They're doctors, they're therapists, they're nurses, the medical staff. He had the whole entire medical staff waiting to assist you to on your road of recovery, on your road to health and wellness. If you do not need the services, I'm sure you know somebody who do need the services. Please forward it to them. I am going to put the updated website information on my website. I'm going to put it on the JADASA webpage, and then I'm going to also point you to the ARCA Facebook page as well. So I want you to know we're about the community. As we say, it's hashtag JADASA 24/7, 365 days, all day, every day. And know that it takes a village.